So, let's talk about the effect of technology on spending, because that's where, frankly, as an actuary, I start caring about medical technology. First, don't misunderstand me. I do not in any way intend to minimize the importance of medical technology and advances in technology. Medicine has changed dramatically since I was a child, and none of us would want to go back. There's a brother that I don't have that I would have had our technology now been available in the 3 days after he was born. I've personally benefited from LASIK, from some pretty funky knee surgery. My wife suffered from a potentially life-threatening heart arrhythmia. A couple of catheter surgeries have solved that. Not only solved it, but solved it on an outpatient basis, which was just truly mind-blowing to me. So we can diagnose and treat things today that we couldn't yesterday. And I'm completely confident that tomorrow we're going to be able to diagnose and treat things that we can't today. And that's an unadulterated good. The issue is someone has to pay for it, and we have to figure out how to pay for it. To put it in context, one CBO report from early 2008, I believe, attributed roughly half of the increase in healthcare spending over the last several decades to advances in technology. I would personally peg it a little lower than that, but for as long as I've been working in this field, actuaries have been attributing a portion of our estimates in increasing healthcare costs to advances in technology. And I think the relevant literature supports us in that.
Is that including or excluding drugs?
That would be both. That would be both. So we would, certainly new drugs are an issue, and for pharmacy plans, it's probably looked at more closely than in other areas because it's easier to track the introduction of blockbuster drugs and drugs going off of patent. So I need to backtrack a little bit. We do think about specific technologies, particularly when we're working with prescription drug plans, because the impact is so immediate and so important. But even there, it's not really the technology we're looking at as much as Dr. Pauly mentioned the economic impacts of the patent system. We're looking at the introductions and then that patent period before they fall off a patent. You know, I'm with Dr. Pauly on this one, I think, when we look at the impact of the legislation on future health care spending. I'm not a complete pessimist. There are things we can do to make our health care system more cost-effective and more valuable. We need to be realistic, though. Smart people have been working on these problems for many years, and there are no magic bullets. End-of-life care has been mentioned a couple of times, and one of the issues that comes up is if you extend life, have you really cut lifetime medical costs if you have that same bucket of end-of-life expenditures at the end of the day? Dr. Garber mentioned that that's a tough nut to crack, and it really is. It really is. I had a personal experience about 18 months ago. My mother-in-law died. And this was not a situation where we had what we think of as the Herculean life-saving efforts with all the high technology. But she was in an intensive care unit for about 11 days. I didn't see the bill. It went to Medicare. But the thing had to be substantial. And these were end-of-life expenditures. She had a massive stroke. And the uncertainty of it all really, really struck me. If you've been in that situation, the doctors, the nurses, the staff try and tell you what the prognosis is without actually coming out and saying it. But I don't know how much Sally could get, but it was very clear to me what they were trying to say between the lines. And when they thought she was going to die, And it was very clear that they thought she was going to die because there was intracranial swelling and they couldn't seem to get it under control. She lived. 10 days later, they thought she was going to live. They transferred her into a regular ward. And it was just heartbreaking for my wife because she finally went home to get a good night's sleep in her own bed. And that evening, her mom died. So when the doctors thought she was going to die, she lived. And then when they were pretty sure she was going to live, she died within 8 hours. It's very easy for me as a finance guy to look back retrospectively and say, why did you spend all that money on these people who are just going to die? The truth of the matter is, at that time, no one knew who was going to die and who was going to live.